All right, this week, week 9, we're going to look at healthcare issues in prisons under the Eighth Amendment. This is Chapter 16. So there's some minimum requirements. Correctional facilities must provide inmates with health care. Confinement cuts inmates off from ordinary health care. Most prisons don't allow them to get their own. At a minimum, they should get treatment for injuries, diagnosis and treatment for medical conditions, and for a serious medical problem that must be looked after before the inmate's release. Charging for healthcare, it's a pretty recent trend. Reason for charging, it's incentive to reduce visits. It's more like real life, and there's just soaring medical costs. Lower courts have upheld this, that prisoners don't have a constitutional right to free medical care. Constitutional requirements, some questions. Is an inmate entitled to medical care and treatment for any health problem? How much health care does a state have to provide? And in what circumstances will a prison official be liable for failing to provide health care? Estelle v. Gamble, governing the constitutional case on prison health care. Gamble, who's a Texas inmate, was injured at work. He sued under 1983, claiming cruel and unusual punishment in his medical care. Supreme Court opinion based on a concern over the denial of that care, which led to unnecessary pain and suffering. It held that this deliberate indifference to serious medical needs constitutes the unnecessary and wanton infliction of pain that's barred by the Eighth Amendment. In West v. Atkins in 88, the question was whether a physician under contract with a state to provide medical services was basically a state actor, and the court held that he was, and that he was acting under color of state law under 42 U.S.C. 1983. In Washington v. Harper, this case dealt with involuntary treatment of patients, especially those who have mental illnesses. The staff needs to know when they are allowed to intervene without the patient's consent to provide such treatment. The related question is, when do inmates have the right to refuse that treatment? In Estelle, this dealt with whether the government could administer antipsychotic medication against the inmate's will. The court held the Constitution does permit the government to involuntarily administer these drugs to a mentally ill defendant facing serious criminal charges in order to make the defendant competent to stand trial. In Thor, the inmate serving a life sentence became a paraplegic while in prison, refused to eat or be fed. The Supreme Court of California held for the inmate, saying the competent inmate had a right to refuse unwanted medical treatment even if it could result in his death. In Singletary versus Costello, a Florida inmate fasted to protect his punitive transfer to another facility and protesting what he alleged to be false disciplinary report. The court upheld in that case also the inmate's right to refuse life-sustaining medical treatment. In the Eighth Circuit Appeals Court, they looked at the issue of drug administration for the purpose of rehabilitation. The inmate complaining is given drugs without consent. The appeals court disapproved. Forcing someone to vomit for 15 minutes for a minor rule violation was cruel and unusual. In Rutherford, lower court in Arkansas looked at whether an inmate could be forced to attend school against his will, and basically the federal district court decided that an inmate had no constitutional right to be ignorant or remain uneducated. Inmate suicides is an issue. One appeals court has stated that a psychological or psychiatric condition can be as serious as any physical pathology or injury, especially when it leads to suicidal tendencies, and a failure of the staff to take steps to save them from themselves, basically from self-injury, can constitute a due process violation under Bell v. Wolfish. HIV and AIDS is another issue. These stats are a little old. This is like 15 years ago. It's certainly a serious health threat in prisons and jails today. There's two Supreme Court cases that have had impact. Pennsylvania Department of Corrections versus Yeski, Yeski was denied placement in a motivational boot camp because of his hypertension. He sued, and the Supreme Court ruled that the ADA does apply to inmates in state institutions. Bragdon dealt with a private citizen, but its holding, which interprets the ADA, gave guidance to prison and jail officials. The Supreme Court agreed with the lower court that Abbott's HIV infection satisfied the definition of a disability. TB is an issue in prison due to the close proximity of inmates and interaction with each other and with prison officials can be an issue. And then another issue is just objecting to testing for these things. An aging prison population continues to be an issue. There's some related medical issues, depression, mental health issues, nutritional issues, ailments. It raises some concerns around food service, making accommodations, assignment to special housing or special programs, and a failure to do so could expose the staff to individual constitutional liability under Section